hospitalization data forever, right? So that we talk about every day, and we have been seeing increasing number of patients in the hospital, although some stability in other metrics like ICU utilization and ventilators. One of the other challenges we're running into that I know that UMC and every hospital is experiencing, as people are having to access healthcare that they've delayed, there are more people going in the hospital for non-COVID related issues, and this does also put additional strains on the system. So those are real issues to be concerned about. As far as the peak goes, we're still recording a lot of cases. I wouldn't say that we know when our peak has been so far. If you look back at our website, you can see the singular date of most cases reported was around April 20th. But as we go forward, until we see it in hindsight, we won't know when our peak is going to be, and we're still clocking a lot of cases. So we'll just have to see, when that is. But we have seen, some relative stability, but we'll have to follow those metrics closely.
Yeah, I would just follow that up by saying, the chart that we look at most closely is a chart that has at the top COVID patients that are hospitalized. The chart just below that is the number of patients that are suspected to be COVID related that are hospitalized. And so if you add those two together for the last 25 to 30 days, the number has been very, very constant. Same is true because the third data point there is the number of ICU beds that are being utilized. And the fourth point is the number of patients on ventilators. And the number of patients on ventilators have been between 75 and 85 now for probably the last month or so. And so while we certainly haven't seen a downturn, what we would suggest to you is the reason we hadn't seen the downturn like, say, New York has is because New York had a huge peak. And when you have a huge peak, then you end up getting on the other side of it. We actually, because Mississippians were appropriate in their social distancing, we never have seen the huge peak. We went up, and now we've plateaued, and we've been within a fairly constant range for 30 to 35 days. So.
Dr. Dobbs, just for clarification, are you saying that we've seen our peak or we have not seen our peak?
We don't know. I mean, the day that shows the most cases so far is around April 20th. But, cases come in, and so we don't really say. We have about a 14-day look-back window because we don't know, when people became ill and then labs got done and all that sort of thing. So we don't really know for sure.
Then why say we've reached our peak at that moment?
Now, I've never said we've reached our peak.
You said we are at the plateau of our peak. It's important not to let our guard down. That was on 2 weeks ago today.
Well, I mean, it's been flat for a long time if you look at it. We've never said we've passed our peak, and we've always been watching it, and it's been flat or flattish, for weeks and weeks. So, I mean, we can parse the words, but we've never really thought that we've seen our peak.
And so let me point one thing out because I think it's important. Again, when we look at the data, I mean, obviously we look at the daily new cases, right? We look at that on a daily basis. But we all know, just like we saw on Friday, daily new cases are largely contingent upon when the testing gets done. The reason our model has worked and the reason we haven't seen the large peak that our neighbors in Louisiana saw is because we're immediately contact tracing. And so we actually know date of onset of illness. And that's really the more important data point to us than is, hey, today we could have 600 cases tomorrow, but the onset of illness, we may get a testing dump from February the 10th, and that doesn't do us any good. So it's about date of onset of illness.